Welcome to the Mental Health Bootcamp podcast.
Woo!
This is the podcast where four mental health clinicians, three of us from Canada, one of us from the United States, serve you cutting-edge mental health knowledge. I'm Dr. Ryan Howes, a clinical psychologist from Pasadena, California.
I'm Dr. Brooke Lewis from the Vancouver area, and I'm a registered clinical counselor.
I'm Joanna Boyd, also a registered clinical counselor from the Greater Vancouver area.
I'm Chris Boyd, clinical counselor, also from the Vancouver area.
Is that Vancouver, Washington, in the United States?
No, it's not, Ryan.
Oh, you're the Canadians then. Okay,
Yeah.
you
Just
guys
to
are the Canadians.
clarify that, yeah.
Okay, yes.
Vancouver, British Columbia, or some people call it the Tish.
The Tish. Yes. That's
No,
only know one
only you,
person.
Ryan.
Yeah,
Only
only
you.
you calls it the
We've
Tish.
never- For those listening, Ryan referred to it as the Tish, and we were quite shocked. And
British Columbia, right? I like to get up to the Tish a couple times a year if I can.
I think Joanna was just flat out offended.
I was slightly appalled, but also
I guess it
humored.
is. I guess it's not fair for an outsider to give your place a nickname, right? But if you did have a nickname, I think the Tish would be a good one. Or maybe not. So, speaking of Canada, I was perusing some social media stuff today, and I looked around, and there's something called the Bell Let's Talk sort of initiative campaign thing that we don't have down here in the States. So I was wondering if you guys could tell me what the heck that is and what it's all about.
So, Bell is just one of our phone providers, or internet phone. Is it just phone? Okay. Anyways,
Yeah.
and so this is called Bell Let's Talk Day. So essentially, they just use today as a way to raise money for mental health initiatives all over Canada. So if you text using Bell, any phone calls, any sharing hashtag Bell Let's Talk, any there's a promotional video by Michael Bublé, singer Michael Bublé. Every time you watch it, all of those 5 cents goes towards
Mental health initiatives.
Mental health initiatives.
And I think over however many years they've been doing this, I think around $110 million has been raised, if I heard on the radio correctly.
Wow.
Yeah, so it's pretty great. Money. So it's really just getting out there. It's important to talk about mental health, trying to destigmatize mental health in general.
Mm-hmm.
That's fantastic. That sounds great.
So there's a lot of sharing of it, and people change their profile photos with like the Bell Let's Talk frame. There's a lot of hashtagging, a lot of people posting quotes about mental health or reducing stigma about mental health, resources. It's
people share their own. Did people share any of their own like mental health struggles, or kind of?
Yeah, for sure.
Oh, that's great.
Yeah, and a great way to raise money. And on a complete, a bit of a side note tangent of this, Michael Bublé also lives in the Tish, not far from where we all live. So we could probably get to his house in, I don't even know, 12 minutes.
Yeah.
Wow.
Yeah.
That's pretty cool.
He's a local guy for us, and he went to the same high school that I did, different cohort, but he was in the same cohort as Chris and Joanna's sister-in-law.
Oh my goodness. Right on.
Local dude.
Yes.
That's pretty cool. Looking this up right now, it looks like on their website it says that over 157 million interactions have been done today. So times that by 5 cents, and that'll be our total so far for today. But it's a 24-hour period. That
Bell will then donate to mental health initiatives.
Yeah.
Good for Bell. That's great. That's a great initiative. Just get everyone talking, get people, reducing
and
stigma.
Sharing. It goes viral really quickly.
Mm-hmm.
Didn't take very long for it to catch on. So.
Yeah, it kind of reminds me of an initiative that you started down south there, that Joe Dilly brought up there. National Psychotherapy Day, trying to
yes,
impact stigma surrounding mental health as well as, of course, therapy, right?
Yes, yeah, that was something that we wanted to do. I felt like if people feel ashamed to talk about their therapy, or if they feel like they have to hide it, then that's really going to reduce the number of people who actually seek it out when they might really need it, or it might be really beneficial for them. So yeah, we started National Psychotherapy Day to try to cut through that shame, that stigma, and get people curious about talking through their problems. I mean, there's an initiative, for psychotherapy, just mental health issues in general. I think there could be stuff for medication. There could be things for, just any number of mental health issues. That's still somehow in 2021, in this modern era, it still seems to bring on shame for people, or they feel like they have to hide it, or something like that. People don't understand it, and it's unfortunate. If you're able to go to your physician to get a medication for your diabetes, or to seek help with something that's not going well, gosh, why not do the same for your mental health? So I believe I'm preaching to the choir here, certainly to you three, but also probably to our listeners as well. If you're on this podcast, then you have an interest in mental health. But yes, support all that. Stop the stigma stuff. It's good for everybody.
It's been quite a year for everyone. So I think I saw that in a lot of interactions. Just it's been a hard year with the pandemic, right? And mental health more than ever has been tested and pushed to its limits for a lot of people. And mental health is something we all have. We all struggle sometimes in our own ways, and it's really trying to, make that normal and not, try to minimize the shame and hesitancy to talk about it. So it's pretty great.
Yes.
Lots of communicating.
Yes, I believe that it's this year has been, for people who were already struggling with some sort of mental health stuff, anxiety, depression, relationship stuff, any of that, trauma. This has just made it much more difficult for them, I believe. And then for the people who maybe never had even considered their mental health to be an issue, the stress and strain of 10 months of all of this has been pretty taxing on people. So it's okay. It's okay to seek help. We talked about burnout a while ago, and you could burn out doing anything if you're not you don't have enough resources. Therapists can burn out, but anyone doing parenting or any job, or just surviving this year, can be burning out.
For sure.
So, okay, Belle, let's talk. And gosh, I wish we had something akin to that down here, where a major corporation gave a bunch of money to mental health. I can think of a few major corporations who might want to do that.
That would be great if they could.
That would be great. It sure would. So, how are you guys doing today? How's your mental health?
Pretty good. Mental health is good. Energy levels a little bit low, but mental health good.
Okay.
Ditto.
I think you said a case of the Thursdays, right?
Case of the Thursdays.
Yes, we record this Thursday nights, and sometimes Thursday is just not close enough to the weekend, huh?
Well, it kind of is the weekend. I don't take clients on Fridays. I just do admin work, so I don't have to worry. It's a definitely different energy level for the brain doing admin work versus client work, but there's still things to do. It's just the end of the week. Tend to pack those 4 days, and
Ditto. Yeah, so it's kind of the weekend warm up tonight, and hopefully tomorrow will be very productive in lots of different ways.
Great. Yeah. Do you do admin stuff as well, Chris?
I do. Yeah, it's nice to have a catch-up day for reports and
absolutely
notes and whatnot. So it works out well. Part of that balance,
Certainly. Glad to do that. Joe, is this the start of your weekend too? Is this everyone's weekend starting right now?
No, I work tomorrow. It's just a 5-hour day for me though. So I find this is the hump I get over. The Thursday's a busy day, private practice day. And I just, when Thursday's done, it's already a weekend warm up for me because tomorrow's not really client heavy. So it's usually, yeah, I look forward to, okay, Thursday's done. Hooray. Weekends just around. Yeah. So close.
Right on.
What about you, Ryan? Do you have a case of the Thursdays or big day tomorrow?
My Fridays are kind of a regular work day for me, and I usually feel pretty energized actually I feel pretty energized in the evening in general most of the time. I feel pretty good. Not as much a morning person, more of a night owl. So and Thursdays I get to talk to you guys, so I feel a little extra zap of energy or charge of energy. It's pretty nice.
Well, that's nice.
Yes.
Zap.
Zap. Bip. Well, let's get ourselves on to our topic, shall we?
Yeah. So on as we're talking about Bell Let's Talk Day, it's very fitting that I'm the topic. I'm the ambusher because my initials spell Bell.
Brooke E.
Elizabeth Lewis.
Elizabeth Lewis.
So
Bell.
today is Bell Let's Talk Day. So I'm going to ambush you.
Please do. Ambush away.
Isn't that great? I didn't even realize. I was like, it is a Bell Let's Talk Day.
That's great. All right, Bell.
Let's talk.
Send your message down from the Tish.
We really got to cut
So
that one.
Okay, I'm sending some mail bush from the Tish.
Oh, really? We've got mailbush. All right, mailbush is mailbag ambush. So here we go. This is interesting. This is a good one.
We haven't really gone into this at all. Yeah.
No, we haven't. Oh my goodness. Okay. Here's the question. Here's the question. What are personality disorders? How are they different from other mental health diagnoses? Right?
Oh, man.
What are personality disorders? Wow.
Yeah.
How
Because
are
I
they
feel like
different?
sometimes, sometimes people use terms loosely
Yes.
without realizing. And as people are becoming more aware of mental health or reading more about it or whatnot, they start thinking about things. So a handful of my clients, I know that they throw around the term like narcissism or so-and-so is a narcissist, which is actually a personality disorder. Or I think they're borderline. So that diagnosis gets thrown around a bit.
Sure. Dependent personality is a big one.
Yeah. So I think sometimes people use the term, but may not totally understand what that means or how it's different, what the implications of that are. So I thought we could just have a discussion about them because they have their own little section.
They do. Okay. Well, this is going to be, all right. We got to get our brains going here. Out of our Thursday
topic for you, Ryan. These guys, are you two Googling right now? Is that what's happening for my listeners? Are they Googling? I'm joking.
This is a challenging one because it's challenging on a lot of levels. One thing is that the whole concept of psychiatric or psychological diagnosis is kind of a challenge.
Yes.
In the first place, because people start off thinking about medical diagnoses, you have a broken bone, you have coronavirus, you have an ingrown toenail, whatever it might be. These are diagnoses that are very tangible. They're very physical. People can look at an x-ray or look at a viral count in the bloodstream or something like that. And they can see, okay, there's something tangible here that is clearly this diagnosis, not that diagnosis. Psychological diagnosis is different. It's kind of based on the same model. I think the psychiatrists who kind of put the stuff in place kind of wanted it to be very similar to medical diagnosis. However, it's not really based on brain scans. It's not really based on blood work. It's based on behaviors and sometimes histories and And
Thought patterns.
thought pattern, yeah, definitely. Or the client's self-report, I'm feeling this, which is subjective. It's not really objective, right? It's someone just saying, I feel this way. And so there's this categorization that tries to say, okay, well, you must be this kind of depressed, or this kind of anxious, or you're severe, or you're mild, or you're moderate, that sort of thing. So the whole concept of diagnosis in mental health it's kind of slippery in some ways. I mean, there've been people who've said, you send the same client to 5 different people, and you might get 5 different diagnoses because it's so slippery. And we're all trained in diagnosis, and it's an important part of the work, and it's an important part of our developing a treatment plan and communicating with other clinicians about what's going on. But gosh, one person's depression doesn't look like the next person's depression oftentimes. And personality disorders are even more slippery, I think. So great topic, Brooke. Give us the answers.
Yeah, I do agree with you, Ryan, that it is a slippery slope a bit. Like, we often look at validity and reliability of these disorders, and there's a lot of controversy within our field in terms of those two things, right? So to your point, I think it serves a purpose in terms of consistency and communication among professionals, and maybe help some clients understand maybe what's going on within them. But there's also a lot of potential concerns too, right? Especially if they start to identify with that, and that starts to become their perception of themselves, right? And we're also finding lately that a lot of clients are coming in after Googling some of their symptoms and using these big terms or these disorders, right? So they come in and sit down and say, I think I have this or that. What I often ask clients is, well, what does that mean for you? Like, can you break that down for me, right? Yeah, so I think it's a great topic for sure, but we want to use some caution because mental health is very different from medicine, physical health, right? To your point, Ryan, in terms of how measurable it can be.
That is true. So we've got this whole category of so this is where it complicates things a little bit more. So it's a good topic here, Brooke. If you don't mind me.
There's many layers.
There are many layers to this.
There's many layers. And part of this too, one of my goals for this conversation is, just in case there's a listener who has been diagnosed with a personality disorder, to kind of destigmatize that a little bit. And
Of course, yes.
Dan, I think it was Dan Siegel that said that every single mental health disorder fits into one of two categories, sometimes both.
Chaos or
behaviors and thoughts that are very rigid, or behaviors and thoughts are very chaotic, right? And often there's a lot of different factors in terms of what can impact someone maybe developing one of these disorders. Trauma, of course, is a big one that can manifest itself in so many different ways, and anxiety generally as well. So a lot of these disorders are often extreme manifestations of anxiety and stress. So throwing more more ideas out there. But
okay, so there are different categories of disorders, and I won't go into the full thing. I'm not going to make this into a whole class on psychopathology.
Kind of letting listeners know how our big book of diagnoses are divided.
Yes, divided up into different categories. And some, for example, there are mood disorders, right? So these are things that have to do with your mood, like depression, for example. If different types of depression, bipolar depression, major depressive disorder, dysthymia. There's all these different categories that have to do with how you're feeling. Anxiety disorders, from generalized anxiety to specific phobias to things like OCD. We have disorders that have to do with trauma, being traumatized at times in your past, some event that occurred and you're having flashbacks and struggling with PTSD, post-traumatic stress disorder. There are other issues that have to do more with focus and attention, things like ADHD, which we should have a podcast on at some point. But then there's this category called personality disorders. And this is a category that has to do with a set of behaviors, a set of thoughts that manifest in a person, that show up in a person in a way that really permeates all their relationships in their life, all of their decisions in their life. Just kind of, it's really deeply sunk into a person, and it really affects kind of the way that they interact with other people, the way that maybe other people interact with them. And we call it a disorder because sometimes that deeply held sense of their personality, of their sense of self, can be really limited by some of the thoughts and behaviors that come along with this personality. Does that resonate with you guys? I'm trying to put it in simple terms.
That's fantastic. Yeah.
I think so. I think it kind of makes sense. What I would add to it is sometimes in that category, it can look like the personality disorders are sometimes look like a bigger version of what would be in the first part of the diagnosis book. Like sometimes those behaviors are often way more like prolonged or interfere with life more deeply or impact more areas. Not always, but I find that often.
And it's like for mood disorders where like it's there's a lot more focus on obviously our management with our moods or up and down or all around. It's more like that's almost just one part of a personality disorder, right? The main focus is not mood. That could just be, there's so many other, the behaviors, patterns, beliefs and whatnot seem to be maybe more of a focus versus mood disorders. I don't know if you'd agree with that, but.
I would say I would agree that the behaviors, the patterns, and the interactions with others. I think it has this category of mental health issues has a lot to do with how people interact with other people and what the impact is on other people, right? So when we talk about narcissism, for example, narcissistic personality disorder, and as you brought up, Brooke, I mean, people kind of throw around the term, oh, she's a narcissist or he's a narcissist or something like that pretty loosely these days. But if we're talking about the actual diagnosis, it's a person with a real sense of grandiosity, who, someone who really feels like they're super important, very special, better than everybody else or most everybody else. Kind of everything they touch turns to gold. And that they should really be treated as that. They should be treated that way. Like I am more important. I am more special than everybody else. And we'll talk in very big terms of how great they are, how many wonderful things they've done. And now that person themselves may not feel all that much distress about it because they've created a world where, wow, I'm the best thing in the world and my life is wonderful. But the people around them could be really negatively impacted by that. Right? They could feel not heard or not seen. Or they could feel like, well, you don't really care about me, or gosh, the things you're doing to get everything you want out of your life is taking things away from me. And so this is a case where it's actually the people around them who are affected by their behaviors that are the most injured by this. The person themselves often is not. And that's why they say actually people with narcissistic personality disorder don't often go to therapy. Or if they do, it's for something else. It's not usually, people don't show up on your door and say, you know what, I have narcissistic personality. I need some treatment for this. That's pretty rare.
No, they could be fully functioning and other, like they could be CEOs of companies or,
Sure. Oh yeah. Yeah. They would look at their life and say, what do you mean? There's nothing wrong with my life. My life's great. I've got everything I want. And
sure, these people are angry with me, but I don't understand why, because what I did was right.
Sure. Yes.
Sometimes.
Yeah. What I did was right. Or they'll realize it at some point. They just don't understand yet. They don't understand well enough how brilliant that move was. So So that's one of these personality disorders, right? One that's been very popular these last few years. Do
And
you guys
I
want
think
to talk?
borderline personality disorder would be another really popular one, I think.
Mhm.
I do think, well, maybe if we have time, explore some more of them, but I do think some of the other ones are potentially more common in our society than what we realize. I think a lot of people struggle with them, but they just aren't talked about as much for
Mhm.
whatever reason. And I don't know if that's just because uh, narcissistic personality disorder and borderline personality disorder are a bit more dramatic or I don't know, more
Yeah.
present, theatrical, so people talk about it more or whatever it may be. They're more outward.
People make movies about it.
People do make movies about it. And Girl Interrupted. I don't know how many mental health movies with women there are, and they all have borderline personality disorder.
Mm.
I wonder if it's the relationship piece, right? Like, I don't like, there might be some personality disorders like schizophrenia where that person might not have as many interactions or might not be as known or specific. I feel like borderline is so, the black and white or the abandonment stuff could be, I don't know, maybe more impactful to the people around them. It depends.
Yeah, maybe. I mean, and all of these things too with the personality disorders come in a continuum. Like it's not you have this or you don't. There's a variety of different markers for each of these, and it's on a continuum of how much does that impair your life. And sometimes some of these continuums, say there's 7 or 8 different things, there might be 3 or 4 that really impact you, and the other 3 or 4 don't really at all. But that all of that's good information. So for borderline, like having difficulties, having a sense of self, so who you are, and really genuinely knowing what that is, impulsivity, abandonment. There's more of them, but I'm not recalling them on my Thursday brain.
The one that I remember memorizing in graduate school was borderline personality is shown by a pervasive pattern of instability in interpersonal relationships.
Yeah.
So
Yep.
just this real difficult time having close relationships that are stable and last a long time.
Yep. Absolutely.
There could be
Absolutely.
some. Go ahead.
Well, I was going to say sometimes it's very much like hot cold, like I love you, but love is scary, so I'm gonna be angry and back away with you. I
Yep.
don't want, but now I don't want you to go, so now I'm gonna lean into you and be around all the time. Like it's just this very yo-yoed effect of I really want to have a close relationship with you, but I'm scared because close relationships have hurt me. So now I'm gonna act chaotic and back away. Yeah. So they often say borderlines and narcissists match up in partnerships.
Really?
Has been
Yeah,
said,
because there's this like the narcissist is, yeah, I don't know. They play off each other.
The narcissist likes to have people relying on them and needing them and feeling like they're really important, right?
And
And
borderlines need that.
and so borderlines who are very unstable in their, like, if you have this sense of instability as far as I'm afraid you're always going to abandon me, they could be really clingy and needy at times, but then rejecting at other times, right? That one of the famous books for people who are either loved ones of someone with borderline personality or people who have borderline personality themselves is called "I Hate You, Please Don't Leave," which is really puts that in great perspective, right?
Yeah, yeah. So very quick turnarounds and different types of reactions. There's also Stop Walking on Eggshells is a popular borderline book for persons who are have a family member or loved one who has borderline personality disorder, because often you feel like you're walking on eggshells. You're not sure what you're going to get. You're going to get someone who's really nice and just endearing, or you're going to get someone who's really, really angry and pushing you away. You're not quite sure. So there's that. And there's also Obsessive-Compulsive personality disorder.
OCPD.
Yeah, OCPD. And I've actually had some clients diagnosed with this over the past little while, younger clients as well, like in their early 20s, with persistent ongoing anxiousness and perfectionism and analysis paralysis, as I like to call it, but just this rigidity, high anxiety, persistent, not going away, and it permeates their being and their relationships. And yeah.
Mm-hmm. How now? Okay, we got to be kind of clear. I mean, again, we're not teaching this course, but there's people will say, okay, well, they might hear you say that and go, oh, so obsessive compulsive disorder is actually obsessive compulsive personality disorder? No, there's actually two diagnoses. One, obsessive compulsive disorder is about a person with kind of, it's something that you could kind of develop as over time, and then it might be specific to a few different parts of your life. You might just have the thoughts, you might have specific behaviors, and it can be treated in a variety of ways, some medication, some therapy. Obsessive compulsive personality disorder is more of, this is a pattern that's been with you maybe your whole life, and it's something that's just the way you see the world, really.
Mm-hmm. And I think that's the best way to describe personality disorders. It's been with you a long time, and it's kind of the way that you see the world.
Yeah.
And so treatment for personality disorders then differs, right? Because it's not something that's episodic.
Right.
Like, a lot of other mental health issues are going to be not always, but like often they're episodic. It waxes and wanes given the stresses in your life or what's going on, your awareness to your thought patterns or your emotions, how you're regulating your self-care. Sometimes these things aren't bothering you, and other times you drop into it for a week or two and then you re-regulate out. Like there's, but for personality disorders, this person is going to have ongoing management or maintenance and awareness of how they're viewing the world, how they're interacting, and how to change those interactions.
Yeah. So you mentioned that it's a little more pervasive. It's been around more consistently in someone's life, but are you saying that someone's born with that, or do you think it stems from things like breakdowns in terms of your attachment, or again, trauma, or I know genetics plays a part of it too. We got to be realistic about that. They say 30 to 40% of the way that we feel is influenced by genetics, but it's not a life sentence though. Of course, we can change these patterns, but
bring on the nature nurture debate. I love it.
Yes,
totally. It always goes back to nature nurture debate, doesn't it? Like
yes,
it's always that. But I do think that trauma plays a role. So there's a researcher, an author, I believe he's an MD. Is Bessel an MD?
Yeah, he is.
Yeah. And so really he believes that BPD, borderline personality disorder, is just a developmental trauma disorder. Right. And he's actually trying to get another diagnosis into our whole book here so that it gets rid of this one, so we could see it from a different lens, to say often persons with BPD and narcissistic personality disorder as well have complex trauma backgrounds.
So what he's suggesting is, everyone's heard of the term PTSD, mentioned it earlier, post-traumatic stress disorder, where a trauma occurs, but it's hard to work through that trauma sometimes. And so your body kind of gets stuck and you have these flashbacks and this anxiety and panic and stuff as a result. And what Bessel's saying, and a lot of other people are echoing this, is what these personality disorders are actually PTSD, but at such an early age that people kind of adapted their personality around that trauma and just kind of became who they are, what their identity is in a lot of ways.
For survival. They survived their environments potentially. And also the trauma typically wasn't one instance, right? Like it was ongoing, persistent trauma.
Sure.
So I would agree with that for sure. I think we're underestimating the role of trauma here and people's early experiences. So again, some of us are more susceptible to developing these disorders. There are some, temperament, for instance, or again, biological or genetics and stuff. But I think a lot of it does stem back to these early challenges, right? And then it shows up, as I was just mentioning earlier, in very chaotic or rigid ways. But usually when there's a lack of treatment or a lack of support there in those early ages, right?
Yes.
And as a result, like people are grouping a lot of these symptoms and trying to make sense of it. And then I guess where some of these disorders come from. But I think there's a common thread there.
So I'll just as a little side note here, I'll give you the way that a psychoanalytic person, someone who's Freudian, might look at narcissism, right? So oftentimes what they look at is the early childhood experiences, right? So you say you have like a 2-year-old child, you have a 2-year-old little girl, for example, who is just starting to talk, just starting to walk, go around the house, and wants to kind of show, I'm unique, I'm special, I have some sort of, I have a talent, I can be funny, I can be cute, right?
As 2-year-olds do.
As 2-year-olds do. I'm doing this, and the parent either ignores it or like shames them for it. Don't do that. Good girls don't do that. Oh, don't try to be funny, right? No, that's not good, right? So they get slammed for that, right? And that's what they would call a narcissistic injury. And like Brooke said, it might have to happen many, many times. But then the child feeling like, okay, wait a minute, you're telling me that when I express my true self, that's bad. So I can't, and that's intolerable for any human being, even a 2-year-old. I can't handle that. So as a compensation, I'm going to imagine that everything I do, everything I touch, everything I say is actually wonderful. And everyone adores me, and everyone's, it's like this big, strong reaction to that. I can't feel like I'm a nothing. I have to feel like I'm an everything instead. So then going through life saying, hey, I'm the funniest person around, and I'm the most beautiful person, or I'm the smartest person in class, all that kind of stuff, regardless of what reality is, that's what they are telling themselves, and that's what they're telling people around them, right? And oftentimes, other people around them start to believe it. Like, oh, I guess, okay, you say you're the smartest person in class, I guess you are. Or if you're that special, I will believe you. If you seem to have a lot of confidence, right? And so that's where the narcissistic thing comes along. And their whole thing is to have people reflect to them how great I am. Hey, I was really great in that play, wasn't I? Or boy, I really am the best player on the team, aren't I? And people will oftentimes just go along with that. Yeah, sure, you're great. And that just kind of feeds into this narcissism, which is show me that I'm wonderful, because deep down I may feel that 2-year-old in me saying, oh, maybe I'm a nothing.
Yeah.
And
it's a recorrective experience over and over and over for them.
Yeah.
To heal that injury.
It is. Yes.
Yeah.
So it's an interesting formulation, interesting way to look at it. I think that there are also people who would say, we have a lot of differences in our personality that don't have much to do with our childhood. Babies are different actually the first day that they're born. There are differences in temperament. And some people would probably say that some people are more maybe prone towards some of these personality disorders. Maybe there's something that made them more susceptible towards that, and then life events maybe kind of kicked it off or enhanced it somehow. But we can't deny the fact that whenever you hear a nature nurture debate, it's usually the answer is some of both, right?
Mm-hmm.
Yeah. But it's an interesting point. I think you were talking about, it was epigenetics there, Ryan, about how it's interesting how our parents and our grandparents and great grandparents may impact our gene expression, meaning certain genes may be turned on under certain circumstances. So we may see these patterns show up through generations, what may make it more likely for us to experience some hardship, right?
Yeah.
But yeah, experiences are huge though. Like those early attachments and how we deal with challenges, uncertainty, and a lack of control. How we tend to cope with that early on while we're trying to make sense of ourselves and our reality is, I think, huge.
It is. It is. Brooke, you were mentioning earlier that, part of the reason for bringing up this topic was that, if there are some of our listeners who are maybe dealing with this or have family members who are dealing with a diagnosis of a personality disorder, to try to break through some of the stigma. And what we're kind of saying so far is that it's a serious condition that's probably been with someone for most of their life, if not all of their life. What sort of destigmatizing hope or message can we give about this sort of thing, do you think?
Yeah, well, I think we're already doing it in the sense that we're kind of planting that seed that it probably didn't pop out of nowhere. Like chances are there is something that was going on that stirred the pot a bit that got this going. Like it's not, we have to have some compassion for how this was developed in the first place, even if that development happened before that person even realized it, right? But chances are there was something's going on back there. Because I think we have to foster some patience for loved ones and family members. We have to foster compassion and patience, I think, or definitely with my BPD type clients and their family members. But as well, for me, I'm thinking we have to, like, in a way, have a sense of acceptance, like to say this is here and this is here for a reason, and we need to figure out a way to work with it. It doesn't mean you're broken or flawed, or like, we need to embrace and accept. We need to lean into this and let's figure out how to make it work so that you can have if this is a person with a personality disorder, how can we make you still have a fulfilling and meaningful life? And if it's a loved one, how can we accept your family member who has these struggles and still accept that with compassion and perspective? Without it necessarily, I feel that personality disorders are stigmatizing, right? Like,
yeah,
that is the one where the frustration, and because it's not easily going to go away. It's something that needs to be ongoing, and like management needs to be ongoing.
Yes.
Yeah.
We're actually at a pretty good time in the world of helping to treat some of these disorders.
Yeah.
And there's been a lot of progress made specifically with borderline personality disorder, and Marsha Linehan's work with something called dialectical behavioral therapy, which has been very helpful. There, oftentimes it's people will join groups that help treat this and help people kind of manage some of these impulses and help develop a deeper sense of security and stability. And so there's good stuff out there. Like I said before, there have been treatments for narcissism for a long time, which usually has to do with kind of helping to heal some of those early wounds if they're there. Unfortunately, not many people go to treatment to seek treatment for their narcissistic personality disorder, which I actually interviewed someone a couple months ago, Dr. Ramani Durvasula, who works specifically with narcissism and the people who are in the lives of narcissists, and oftentimes says, look, if it doesn't look like they want to change, then you got to find ways to protect yourself or get out. So I'll post a link to that, as well as maybe some of Linehan's work and some other things.
Linehan has like a autobiography memoir type book too. That might be a good one to post because it tells a little bit more about her story and how it was developed, as well as a little bit about the theory. Like, it is a good mix, and she has some interesting quotes in there. It's good.
Yes.
Yeah.
Yeah, I think I'm generally, I'm optimistic. I agree that there's some great therapeutic approaches to help people with personality disorders. I think the two that stand out, you mentioned narcissism, as well as good old antisocial personality disorder, which is also very popular. Lots of movies and shows kind of gravitate toward that type of criminal behavior, right?
Can you describe that one for us, Chris, for the listeners?
Yeah, like antisocial personality disorder, jump in there if I, based on how I describe it here, but it's often described in lots of different ways. The terms like psychopath or sociopath. So someone who is very much void of empathy, who are capable of doing pretty brutal, awful things to others as a result. So there's a range here in terms of those who have antisocial personality disorder. Some are highly functioning and and others could create crimes or harm others, and show very little remorse for that. But something interesting happens though, is they've done lots of different therapy with this group of clients and or individuals, and they find that there's not actually a whole lot of change happening under the surface. What is happening is they're learning how to act or learning how to answer questions, and
So they're
sometimes
like Dexter.
yeah, sometimes that's used for manipulation purposes, right? So it's very intriguing, but maybe that's one area I'm not as optimistic about in terms of treatment.
Helping them to become more empathic and care about people again, huh?
Right. Just kind of that cluster of person can be really difficult.
Yes.
It can be difficult. Yeah, I'm sure there's definitely ways to support them and tap into that empathy and maybe build a bit of compassion there, but a bit of a challenging situation to deal with.
Challenging situation, challenging topic. We should probably revisit this and maybe at some point just go through some of these disorders one by one and figure out like what we have to say about that, right? There's a lot. I mean, we talked about a few, but you know, there's the whole like schizotypal and schizoid personalities. I mean, there's a lot of different interesting names, at least, and interesting disorders.
Which is then again on a continuum, right? When we're looking at bipolar disorder all the way up. So it could be argued that it's more on a continuum, right?
That's right.
Joanna, did you have anything to pipe in about like the nature nurture or the trauma history part or anything?
Oh,
Just
man.
working with like children and parents.
I've been enjoying listening and learning from you guys. No, I think I agree mostly what's been said in terms of, I think there's a bit of both. I think there's definitely could be some predisposition in terms of genetics and whatnot, but I think nurture plays a big role in maybe some early trauma. I think sometimes that comes out a lot in border or BPD, I can't think of the name right now. Borderline. Thank you. Yes. Oh my gosh.
Thursday. It is Thursday.
Holy. So I think when looking or working with someone with some personality disorders, I think it's important to look at all those potentials in terms of helping them and healing old wounds. And but yeah, I don't really have too much to add than what's been said. But.
I know that you work with kids sometimes or often, children. Do you pick up if there's that tinge of a personality disorder in a parent, and does that impact like how you might work? Because you involve the parent, I would think, in homework and things.
I think a lot of the clients I've worked with, I see a lot of, not so much the personality I've been able to identify in the parents I've worked with. I'm sure some people can, but it's been a lot of more like parents who are anxious and then their kids are anxious, or if a parent has a history with depression or another mood disorder, that kind of has played a role. But I have not so much, or I've heard in consults hearing about parents who might have the narcissism and whatnot. But yeah, I haven't personally worked with a lot of parents who've fallen in that personality disorder area, but I've had some kids. It's hard too with kids because some of these personality disorders can't really be diagnosed until they're older, but you might see twinges of lack of empathy or things like that. And you're just like, ooh, we got to be careful with this one. Or, you know, educate or encourage the parent to kind of get supports as time goes on. But yeah.
Rich topic, you guys. Lots to say, but we're going to sign off for now. So I hope you guys enjoyed it. Brooke, great topic.
Yeah, good job, Brooke.
Hats off to you. That was
wow,
a big one to
guys.
bite off on a sleepy Thursday, huh?
I know. It's like, let's go into this one.
Yeah, that's great. We'll hit it hard again next week.
This will be the new one. Instead of sleep hygiene, it will be personality disorders number 2.
Part 5, personality disorders. Okay, everybody, like and subscribe on Apple, Google, Podbean, Audible, or YouTube. Send your questions to info@mentalhealthbootcamp.com. Visit us on Facebook or Instagram. Tell a friend or 2 or 20. And Have a great, wonderful week and weekend, everybody. See you later.
Bye, everyone.
Hi, everybody.
Bye-bye.